A 65-year-old patient presents with chronic fatigue and mild hypomagnesemia, 1.4 mg per deciliter. The patient is currently taking magnesium oxide 400 mg daily but reports no improvement in serum levels and complains of persistent osmotic diarrhea. Which of the following best explains why magnesium oxide is considered a poor choice for replenishing systemic magnesium stores? A. It has a low percentage of elemental magnesium by weight. B. It is an organic salt with high water solubility. C. It has a very low fractional absorption rate, bioavailability 4%. D. It is rapidly cleared by the kidneys before tissue uptake. Answer: C. It has a very low fractional absorption rate, bioavailability 4%. In the context of longevity and neuroprotection, a physician considers a form of magnesium capable of crossing the blood-brain barrier, BBB, more effectively to increase cerebrospinal fluid, CSF, levels. Which form is specifically documented to achieve this? A. Magnesium citrate. B. Magnesium L-threonate. C. Magnesium sulfate. D. Magnesium taurate. Answer: B. Magnesium L-threonate. A patient with a history of fibromyalgia and chronic fatigue syndrome is seeking a magnesium supplement that may specifically aid in cellular energy production and muscle tenderness. Which form is chemically bound to an intermediate of the Krebs cycle, citric acid cycle? A. Magnesium malate. B. Magnesium glycinate. C. Magnesium orotate. D. Magnesium oxide. Answer: A. Magnesium malate. A 72-year-old male with stage 4 chronic kidney disease, CKD, begins taking high-dose magnesium supplements for leg cramps. He is brought to the ER with loss of deep tendon reflexes, hyporeflexia, hypotension, and bradycardia. What is the most likely cause of his symptoms? A. Magnesium deficiency causing tetany. B. Hypermagnesemia due to impaired renal excretion. C. Hypocalcemia induced by magnesium malabsorption. D. Acute vitamin D toxicity. Answer: B. Hypermagnesemia due to impaired renal excretion. A patient is prescribed ciprofloxacin for a urinary tract infection. Which instruction regarding their magnesium glycinate supplement is most appropriate to ensure antibiotic efficacy? A. Take the magnesium and antibiotic together to increase absorption. B. Discontinue the magnesium for the entire duration of the antibiotic course. C. Take the magnesium at least 2 hours before or 4 to 6 hours after the antibiotic. D. Switch to magnesium oxide, as it does not interact with fluoroquinolones. Answer: C. Take the magnesium at least 2 hours before or 4 to 6 hours after the antibiotic. A 55-year-old patient with osteoporosis is prescribed high-dose vitamin D3, 5000 IU, and calcium. Despite supplementation, her serum 25-OH-D levels remain stubbornly low. You suspect a magnesium deficiency is hindering her progress. What is the biochemical role of magnesium in vitamin D metabolism? A. Magnesium is required for the intestinal absorption of fat-soluble vitamin D. B. Magnesium acts as a cofactor for 25-hydroxylase and 1-alpha-hydroxylase in the liver and kidneys. C. Magnesium prevents the degradation of active vitamin D by the CYP24A1 enzyme. D. Magnesium is required for the synthesis of vitamin D from cholesterol in the skin. Answer: B. Magnesium acts as a cofactor for 25-hydroxylase and 1-alpha-hydroxylase in the liver and kidneys. Which form of magnesium is most often recommended for patients with hypertension or cardiac arrhythmias because it combines magnesium with an amino acid that has independent antioxidant and calcium channel blocking properties? A. Magnesium sulfate. B. Magnesium taurate. C. Magnesium malate. D. Magnesium orotate. Answer: B. Magnesium taurate. A patient with a history of recurrent calcium oxalate nephrolithiasis, kidney stones, is advised to take a magnesium supplement. Which form is specifically preferred for its ability to increase urinary pH and bind to oxalate in the gut? A. Magnesium glycinate. B. Magnesium oxide. C. Magnesium citrate. D. Magnesium L-threonate. Answer: C. Magnesium citrate. Magnesium glycinate is often cited as the best form for anxiety and sleep. Aside from the high bioavailability of magnesium, what is the secondary mechanism provided by the glycine component? A. It acts as an inhibitory neurotransmitter and a coagonist of NMDA receptors. B. It increases the half-life of melatonin in the bloodstream. C. It stimulates the production of cortisol to balance circadian rhythms. D. It blocks the reuptake of serotonin in the synaptic cleft. Answer: A. It acts as an inhibitory neurotransmitter and a coagonist of NMDA receptors. A physician is evaluating a patient for latent magnesium deficiency despite a normal serum magnesium test, $2.0 mg/dl, Which of the following tests would provide a more accurate assessment of the patient's intracellular magnesium status? A. Urinary magnesium excretion, 24-hour. B. Serum ionized magnesium. C. RBC, red blood cell, magnesium. D. Serum magnesium oxide concentration. Answer: C. RBC, red blood cell, magnesium. A 48-year-old patient is admitted to the ICU with a specific cardiac arrhythmia known as torsades de pointes. Which form of magnesium is the gold standard for acute intravenous, 4, administration to stabilize the cardiac membrane, and why is an oral form contraindicated in this emergency? A. Magnesium glycinate, it is too slow to absorb. B. Magnesium sulfate, it allows for rapid dissociation of Mg2+ ions in the plasma. C. Magnesium citrate, it may cause electrolyte imbalances in the colon. D. Magnesium taurate, it is only available in liposomal forms. Answer: B. Magnesium sulfate, it allows for rapid dissociation of Mg2+ ions in the plasma. 12. A biohacking patient asks about magnesium orotate, claiming it is the secret to athletic longevity and heart failure recovery. What is the proposed biochemical mechanism of the orotate moiety? A. It increases the excretion of sodium to lower blood pressure. B. It acts as a precursor to pyrimidine synthesis, supporting RNA/DNA production in stressed cardiac tissue. C. It prevents the calcification of the aortic valve. D. It directly stimulates the release of growth hormone. Answer: B. It acts as a precursor to pyrimidine synthesis, supporting RNA/DNA production in stressed cardiac tissue. A patient has been taking omeprazole, a proton pump inhibitor, for GERD for over 5 years. They now present with muscle cramps and tremors. Why are PPI users at high risk for worst-form magnesium failure? A. PPIs increase the renal clearance of magnesium. B. PPIs inhibit the TRPM6 and TRPM7 transporters in the intestine by altering local pH. C. PPIs bind to magnesium glycinate and form an insoluble precipitate. D. PPIs stimulate the parathyroid gland to dump magnesium into the urine. Answer: B. PPIs inhibit the TRPM6 and TRPM7 transporters in the intestine by altering local pH. When reading a supplement label, a patient sees magnesium as magnesium oxide and magnesium citrate blend. This is often referred to as a buffered magnesium. Why is this considered a marketing worst practice for someone seeking longevity? A. The oxide buffers the citrate, making it less acidic. B. It is often a way to hide cheap, poorly absorbed magnesium oxide while putting citrate on the front of the bottle. C. The blend causes the magnesium to bind to vitamin C, neutralizing both. D. It prevents the magnesium from reaching the mitochondria. Answer: B. It is often a way to hide cheap, poorly absorbed magnesium oxide while putting citrate on the front of the bottle. In the prevention of migraine headaches, the American Academy of Neurology notes that magnesium may be effective. Interestingly, despite its low bioavailability, magnesium oxide is frequently used in clinical trials for this purpose. What is the rationale? A. It has a placebo effect that is stronger than other forms. B. It contains the highest percentage of elemental magnesium by weight, 60%, allowing for massive doses in a single pill. C. It specifically targets the trigeminal nerve. D. It is the only form that doesn't cause diarrhea at 400 mg doses. Answer. B. It contains the highest percentage of elemental magnesium by weight, 60%, allowing. Magnesium is an essential cofactor for over 300 enzymatic reactions. In the context of metabolic longevity and type 2 diabetes prevention, magnesium is required for the proper functioning of the insulin receptor tyrosine kinase. Which of the following describes the effect of magnesium deficiency on glucose metabolism? A. Increased insulin secretion from pancreatic beta cells. B. Reduced autophosphorylation of insulin receptors, leading to insulin resistance. C. Enhanced glucose uptake in skeletal muscle via GLUT4 translocation. D. Inhibition of gluconeogenesis in the liver. Answer. B. Reduced autophosphorylation of insulin receptors, leading to insulin. A 28-year-old female patient suffers from severe premenstrual syndrome, PMS, specifically reporting significant water retention, breast tenderness, and mood swings. Clinical evidence suggests that combining magnesium with which vitamin significantly improves these symptoms compared to magnesium alone? A. Vitamin B12. B. Vitamin B6, pyridoxine. C. Vitamin K2. D. Vitamin E. Answer. B. Vitamin B6, pyridoxine. Many longevity influencers advocate for transdermal magnesium, magnesium oil/sprays, or Epsom salt, magnesium sulfate, baths to bypass the digestive tract. What does the current high-quality clinical evidence say regarding the systemic absorption of transdermal magnesium through intact human skin? A. It is 5x more effective than oral supplementation. B. It is the only way to reach brain saturation levels. C. Evidence is largely anecdotal. The human stratum corneum is a highly effective barrier against significant magnesium ion transport. D. It works only if the water temperature is exactly 102 circ. Answer. C. Evidence is largely anecdotal. The human stratum corneum is a highly effective barrier. At the most fundamental level of longevity, magnesium is a necessary cofactor for DNA polymerase. What is the consequence of chronic magnesium deficiency on the aging process at the genomic level? A. Accelerated shortening of telomeres and impaired DNA mismatch repair. B. Increased production of collagen in the extracellular matrix. C. Overexpression of the SIRT1 longevity gene. D. Permanent activation of the mTOR pathway. Answer. A. Accelerated shortening of telomeres and impaired DNA mismatch repair. A patient presents with subclinical hypomagnesemia. During a physical exam, you inflate a blood pressure cuff on their arm to a level above their systolic pressure. After 3 minutes, the patient's hand goes into a carpopedal spasm. What is this clinical sign called, and what does it indicate? A. Chvostek's sign, indicating vitamin D toxicity. B. Trousseau's sign, indicating neuromuscular excitability, hypocalcemia/hypomagnesemia. C. Babinski sign, indicating upper motor neuron lesion. D. Holman sign, indicating deep vein thrombosis. Answer. B. Trousseau's sign, indicating neuromuscular excitability, hypocalcemia/hypomagnesemia.